I'm Dr. Amin, and I'm a physician by training. And currently, I'm working in the capacity of Clinical Services Manager at CareHub. CareHub is a sister company to Tribe Consulting, which is one of the leading BPOs in Pakistan right now. CareHub is a healthcare outsourcing company, and over the last few years, I have been leading teams that work as an extension of US-based medical practices, and we are providing them HIPAA compliant services. It includes front desk, back office, medical scribing, medical billing, all these services. Our company has a global outsourcing vision, and while we are currently helping US providers, our vision is to reduce the cost, to improve efficiency, and to scale patient care without compromising the quality. While when I asked a few questions over the email thread, and I realized that you guys are working on integrating AI into digital health, that was the area which excited me because my broader vision is to actually bridge global healthcare operations and bringing together the technology, intelligent workflows, and skilled teams to make the healthcare more accessible and scalable. Um, Healthcare, which is not divided by boundaries and is virtually accessible across the globe. And telemedicine is what is going to, is going to make it possible. I'm really excited because you guys are all more or less working on the similar domain, and you guys are bridging technology and healthcare innovation. And I'd love to contribute my perspective on digital health shift. And I am really, really excited to have this conversation today.
Yeah, yeah, thanks for that. And so we'll just dive right in. I guess first tell me a little bit more about you. I think you've only been at CareHub for a year, 2 years, a few years. Would love to kind of double tap into what made you join CareHub, what kind of sparked something different, and kind of, what was your, reason for joining that organization?
Mhm. Okay, so first thing, I started my career while I was just an undergraduate, and I started working in Tribe Consulting. And Tribe Consulting is a BPO, which is currently outsourcing business again from the US. And we have various different campaigns and different, we have clients like Papa John's and various different pizza chains from the US. Pedal and yeah, various different clients we have in Tribe Consulting. I did get a chance to work with as a virtual assistant with Dr. Jeffrey Weinswig, who is a plastic surgeon. His office is based in Chicago. That was back in the year 2017, 2018, and 2019. I graduated, I completed my medical school, and then I stepped out of this industry, went back to my own industry, spent 3 years in clinics. And it was during my clinical years when I realized that even the most skilled doctors, they were only able to impact, a limited number of people, limited number of patients directly. But through, this kind of business and digital healthcare, we can make systems and we can impact and access outcomes at a scale. So I was looking around for the opportunities, and since Tribe Consulting is also my family business, it was, they started a healthcare company, and I gotten a chance to come here and start working in the management. So when I transitioned from clinical practice into healthcare management, I saw how technology can dissolve geographical barriers and it can bring quality care to patients. Um, can you hear me, Robert?
Yep, yep.
You can? Okay. So I realized that how we can dissolve these geographical barriers and we can bring quality care to patients globally. And with technology, with AI, and with the evolving, every day we are evolving, we're getting better in terms of technology. And this was the point which truly inspired me. And I thought, why don't we go ahead and, start bridging the healthcare systems, connecting US providers to teams here in Pakistan, skilled compliant teams here in Pakistan. It's totally possible globally. You can, connect medical practitioners from the US to different countries without having to worry about the borders. So this was what inspired me, and it truly excites me, and I want to make an impact on a wider scale. And globally is a huge word at the moment. I'm not I'm I would say I'm really very not very experienced to say that I can actually create an impact globally. But since I want to explore, and a couple of weeks back, I was, searching for different opportunities where I can learn AI and I can, impact, make systems, automations, and transformations, and to incorporate that into our workflows here in the company. So I believe the next evolution of healthcare isn't just digital, Robert. I tell you, it's intelligently connected. Technology, human expertise, and compassion. And all these things, when they'll come together, we'll be able to create a space where virtual healthcare will not only be accessible, but it will be, scalable and with efficient, improved outcome, improved care coordination, and patient satisfaction. So this is why, on a wider scale, this is my a reason to work in this capacity. Um, 5 to 6 years experience in this business, 3 years in clinics. I am a physician right now. I don't have any degree after my medical school, but I am an aspiring, an aspirant for MBA. So very soon I'll be, tapping into that and start. And hopefully in 2026, my plans are to start MBA as well. So this is a little about my journey, my career.
Yeah. No, that's amazing, and thank you for sharing that. And yeah, I think one of the things you said is around impact, and I can tell you're a person who yeah, cares, about people and your employees and others. So thank you for sharing that. So when it comes to, and I'm just gonna do some rapid fire questions here. So when it comes to, I guess, implementing AI today in your business, what have you seen has been maybe the hardest and biggest challenges there?
At this moment, the only area where we have incorporated AI is quality assurance. We And it's just not about healthcare. Since I told you, we are a daughter company to Tribe Consulting, and we have various campaigns running there as well. So we are integrating our AI into that area where because most of the team members here are on calls. Since we are an extension to medical practices, they are on calls, and that's the very important and critical area of our services, because we really want people to talk in a certain professional manner, respect people like patients' privacy, and there's a certain way of speaking to patients. So what we do is we when they're done with the calls, we have designed a system where we are going to have AI listen to those calls and flag any red flag any of the areas which are questionable, like certain words, change in the tone, maybe rude behavior, or maybe dissatisfaction of the patient, or if the patient gets frustrated, or if there's repetition of few questions, those questions coming back and again. So yeah, I would just flag those things, and then we are going to step in and listen to those calls and make sure that okay, these are the areas where our team members need quality check, maybe training, maybe correction. So this is currently the only area where we have utilized AI. While a couple of places where we are currently planning and we're checking the possibilities are incorporation of AI into RPM and CCM services. RPM is remote patient monitoring and CCM is chronic care management. So as you know that in remote patient monitoring, all patients' vitals are there on the software. So instead
Yep.
of having a lot many people sitting and you looking on the stats, um, AI would just flag any change, predictive analysis kind of work,
Yep.
which AI
Yep.
would do for us, and it is going to predict if there is any deterioration, expected deterioration in the condition of patients, and those will be the patients we'll be very looking at on with a great focus. And then, of course, scribing is another area of challenge where we would want AI to, like speech to text, or these kind of things which want AI to help us in. This is eventually going to reduce the burden on the workforce and efficient and increase the efficiency at the same time, reduce the errors, human errors. If that answers your question.
Yeah, no, that's a great answer. And again, I know this is a podcast, so you can tell me if you don't want to answer this next question. I was curious on, like how big is your company? Like how many people do you have today doing the scribing work today? How big is that workforce?
Okay, so currently we are doing scribing for one, two, three, four different clinics, and
Okay.
it's live scribing, mostly live scribing, and we did get a chance to work on transcribing as well.
Hmm.
We also are currently working with the clinic where they're just giving us handwritten notes, and we've just, handwritten as in a single line typed in by the practitioner, and he would put in those whatever any if there was any positive finding in a patient, or if there was any positive finding during a physical examination of a patient. So they would just put in all those main things or highlights of their patient encounter, and my scribers are then going to go ahead and they're going to make the entire chart. So this is also kind of scribing which we're currently doing.
Gotcha, gotcha. And in a perfect world, like again, let's move money aside, people aside, like in a perfect world, like when you think about the way that AI can impact your business today, like let's say you had one magic wish, right? I don't know, like what would be, I guess, the way you would see AI kind of impacting your organization? Is it on the more of on the scribing side? Is it more of on the quality control side? Is it more on increasing your throughput with your current team? Like, talk me through, I guess, if you had a dream state of like, hey, this is where I see this making the most impact quickly and fast.
That's of course the quality, because there is no endpoint of quality, Robert. You can improve quality. There's always a room to improve. So I would really, that's a magic wish that I would want, because I think anyone can make a system. But an excellent system, again, it doesn't have any limit. So I would believe I would want the quality to be an area where AI should make an impact. And then that's RPM and CCM, because these are currently a couple of services which we are planning to have. I'm running a market analysis on these services, and we were I mean, since we are just in initial stages of planning how we are going to provide these services. Therefore, um, I think that this is also one of my magic wishes, where I would want AI to, do that predictive analysis of the patient's vitals and uh, their numbers to see if and flag them, and so our team can pick those things up. And that's exactly kind of a wish, because that is not what we're currently doing. But quality is hands down the thing I want AI to make an impact on.
Gotcha. Yeah, no, that's amazing. And those are great things. And one thing I've usually asked people, especially, executives and leaders like yourself, is like, how do you go about actually searching and creating a business case for AI internally, right? Like, AI to some people is scary. AI is sometimes like, I don't know if we should do this or invest with this. Like, so as a leader, like how do you like when you guys purchase the AI for the to do the analyzing of the calls, like talk me through, and again with my audience, I think we may have other business owners who may be interested in like, I want to try this AI thing, but like I don't know how to sell it internally. I don't know how to do market research. So like as a leader yourself and you have some great use cases and ideas already, I could tell how do you develop that mindset internally and kind of also maybe get your team on board and your other leaders who may have to buy into the solution on board to what you're trying to accomplish.
See, Robert, this is a teamwork. I can have ideas, but I cannot do everything. I'm not from the tech background. I'm a doctor by my training, so I really want to highlight here that we have a similar, people with similar mindset within the company, who are tech savvy, who know the importance of AI, and including myself, because it has to, there has to be an acceptance that AI has this potential to actually revolutionize not only healthcare, but any industry which it touches. So that is, I mean, since I have similar people with similar mindset, so those were the people, and those are the people who are going to create the systems, while I'm just here, to who can help them by highlighting the areas where we need to, where we can use AI and improve the efficiency. So maybe I'm not the right person to tell how we develop those systems, but I can only, tell you areas where I think AI can work, improve the efficiency, where we are currently doing it, where we're planning to do it, and where we can potentially do it.
Gotcha. Yeah, no, that's amazing. Thank you for that. And then I noticed on again, I'm not sure if I have this wrong, but I saw you guys company LinkedIn profile. Are you guys based in Texas and US and then Pakistan? Is that like where most of the team members are, or is it spread out?
Okay, so we are currently a care hub. Operations are currently being operated from Pakistan. However, since we are a sister company to Tribe Consulting is a registered BPO, a registered company in the US. So we, on the whole, this entire company is outsourcing business from US, healthcare or retail industry. So our team is operating from Pakistan. And we have
Gotcha.
operation,
Gotcha.
offices across the country. We have offices in three different locations here, in Karachi, Lahore, and Islamabad, three different cities of Pakistan.
Gotcha. Okay, I got two last questions, I promise. So first question is more on the again business side, and then the last one is more personal. So first question, when you look at from an operational standpoint, like what KPIs or metrics do you look for, I guess, to hold your team accountable? Because I think the biggest thing is like whether you're purchasing an AI tool or an automation tool, we have to tie that back to some level of ROI, of like value and investment. So I'm curious, like, what are like the big, metrics that you're usually measuring your team by, and how do you go about maybe ensuring your team hits those KPIs and metrics?
Okay, so since I said that we are an extension, and most of my team members, I mean, every one there on in my team is currently contacting patients and the teams there in the US over the phone calls. So our quality basically is that we maintain those conversations on the phone calls. Now we are doing a wide range of services. We are giving a wide range of services, um, from if we start from the basics like front desk appointment scheduling, to reschedules, to appointment confirmations, to patient outreach on doctor's behalf, to scheduling patients for annual visits, etc. And then the referral management, insurance verification, prior authorization, billing, scribing. Every service has its own KPIs.
Yeah.
While we have these standard KPIs, since all of them are phone calls, I would just give you an example, like the standard of quality assurances, the tone of their voice, the rapport building with the patient, so initial greeting, end greeting, and resolution, outcome of the call, patient satisfaction, all these, standards of quality. They join together to make, those KPIs, while every different service has their predefined KPIs. And since I said quality is a work in progress at all times, so we make sure that our team is not only educated, they are not only informed about those KPIs, but at the same time we have all those training systems in place, the trainers within the team who are actively working and reassessing those KPIs and making sure that everyone is on the same page and at the best of their, capabilities, they are giving the best services. Uh,
Gotcha.
we can go into the depth of, the KPIs. It has for every different services, these KPIs have different weightage. That's a whole different subject, and a lot of
Yeah.
information there. But yes, we do have KPIs, and I think KPIs and these preset standards are what makes operations transparent and what help us work with, a clarity of mind.
Gotcha. Yeah, no, thanks for that, and thanks for sharing your time. It's been really good, been great to know you. So this is one last question that I mix up my last questions a bit. So if there's someone watching this or listening to this, however it goes out, what's one piece of advice that you would give someone who is just starting their career in the healthcare space? and they're trying to be a leader, they're trying to, grow and maximize themselves, what's one piece of advice that maybe you have adopted in your career, or that a mentor or someone have shared with you that has just carried you a long way?
I would say man is the master of his soul and captain of his ship.
Mm,
Every person is the master of his soul and captain of his ship. You work in whichever capacity you want to work in, whichever industry, doctor, engineer, whatever. You when you want to attain that, if you know that you can, you are master of your own ship, and you dream of being excellent, then you are going to take yourself to places where you can, learn and develop yourself. So learning and development is a non it's a place where you can, improve, learn every day. You can learn every day. So if you are driving your ship, being a captain of it, go towards excellence, learn and develop. Never close your doors to learning. You can never
yeah,
learn enough. That's my piece of
yeah.
advice to anyone listening to this, because that is this attitude is, Robert, what takes us to places.